Hey guys, we are back with Abbie, and Abbie is a runner and a triathlete. She also does have a history of some side of the ankle discomfort and of actually a couple of injuries as well. Just a little bit more than discomfort at times. So I figured that would be great to kind of dive into some lateral ankle pain, lateral ankle discomfort that you might be feeling, what can contribute, and what potentially to start to think about, to dive into. But obviously, as always, please reach out to a medical provider if you are having any pain. This is just for educational purposes.
Well, hey y'all. So as Laura said, I have had some lateral ankle discomfort and pain for several years now. My senior year of college, I fell down a mountain and fractured my fibula. Sorry. And also ruptured all three peroneal muscle bellies that attach to that fibula.
And so those are the ones that are on the side of the ankle.
It was a very fun time, to say the least. Did months and months of PT and rehab. We learned how to walk. And then a couple years after that, got into running, was running my first ever half marathon, had already had some knee pain and felt a pop in my ankle. And lo and behold, I dislodged one of my screws from my original surgical site and ruptured all three peroneal muscles again. So I've been definitely going to PT for several years now.
So there are multiple other things that can be going on. Yes, it can be those peroneals that Abbie was talking about and Abbie has experienced herself, but you also have to rule in or out other things that can potentially be happening. So we're going to list a couple. This is a non-inclusive list. So more things can be happening, and it can be a combination of a couple. It can be specifically one. It could be one that we don't even mention. That's why getting assessed by a medical provider is important. So we can have, just like you think about lateral ankle pain, maybe you had an ankle sprain, rolling your ankle out to the side. That's the most common way, although you can roll it inwards as well. But for right now, we're going to be talking that. So it can be a ligament injury on the side of the ankle.
Again, you can also have a peroneal muscle issue. So it can be coming from the muscle belly itself, which is a little bit higher up in the leg, as well as having your peroneal tendons, which run a couple different ways along the foot and the ankle that can also be inflamed or having discomfort.
And then you can also have the side of the hip actually can refer down to the side of the calf as well. So a lot of people don't really think about it. It could potentially be coming from the hip, and you can be having some referred pain down.
Speaking of referred pain, you can also have some nerve problems coming on. The peroneal nerve being the most common with the lateral leg. So that comes and starts at the top part of the calf and then rolls down and follows your fibula. And that would be your peroneal or fibular nerve.
And that is a branch of the sciatic nerve, which is that common one that people think about coming from the back. And then you can also have it truly coming from the back and more one of those nerve roots. So it can be the lower lumbar spine that cause some discomfort in that area as well. So taking an overall approach to things can be important as well.
So those are just 5 things that could be going on. Again, this is not an inclusive list for everything, but nerves can also be a little finicky. So we're going to leave that to you guys. Definitely, if you think it's more of a nerve issue, please seek medical attention and see if you can get assessed by a medical provider.
They can just guide you a little bit more with the specific exercises and other interventions that might be appropriate for you. And like Abbie said, they can be a little bit finicky, so you don't want to mess that up doing it yourself and trying things. So as we mentioned, it can potentially be a lateral ankle sprain and some injury to those ligaments. So ligaments are a little bit different than muscle. They are non-contractile, which means they don't contract and move. So like muscles, they can stretch and then can contract. Ligaments cannot do that. So when you have a sprain, they potentially can get stretched depending on the severity of the sprain. You can have a complete rupture like Abbie does on her other. Is it the same side or is it the opposite side? Yeah, so Abbie also has it on the opposite side with the ligament injury. And so essentially with that, you need those muscles to compensate for the increased laxity. So you have active stabilizers and passive stabilizers. Active stabilizers are those muscles, and then passive stabilizers are those ligaments and the capsule and things like that. So we were specifically talking about those ligaments. They are completely torn. No, they cannot necessarily reform. You can increase stability through that area via other mechanisms. So essentially, goal is to strengthen the muscles around it, build proprioception, which is essentially where your body is in space. So if you're standing on one leg, that requires some proprioception to know, to have that fine corrections. And those, you have sensors in those ligaments that do tell your brain where your body is in space. So relearning that can be very helpful too. And then obviously gaining back the range of motion that you may have lost because that joint may have stiffened up or those muscles around might have tightened up as a protective response after that injury. So we're going to show you a couple exercises just to kind of loosen things up. So we're going to start with some range of motion exercises. So you can do a self-dorsiflexion mobilization to target more so the joint. So Abbie is going to kneel down on the ground. And you can do this a couple different ways. So you can use your own hand and reach around your ankle just below the ankle bones and then rock forward. So she's just rocking forward here, keeping that heel down on the ground. You can also wrap a band around an anchor as well, but this is an easy thing that you don't necessarily need any equipment for. And then a soleus and gastroc stretch, which is the muscles in the back of the calf. You can do this standing, you can do this in like a downward dog position, or you can do it against a wall as well. So coming here, you can go, the leg is staying straight, toes are there, and then also if it's the soleus stretch, you're just gonna bend the knees slightly there. So essentially, gastroc stretch, soleus stretch, heel is still staying on the ground with both legs. You can have your toe on the wall, and then with that soleus stretch, you can have your foot on the ground, leaning forward to the wall. So there are tons of different ways that you can do that one. And then working proprioception. So this can be really any sort of balancing exercise. You can just stand on that one leg. Doing it on a different surface is going to make it a little bit harder. So if you have like a mat or cushion or something like that, the Eric's pad is often used in the clinic. Or you can do like single leg RDLs. So turning to the side here, standing on one leg, going forward, keeping those hips square is really going to work the balance a little bit more dynamically. So chest is going down, foot is coming up at that same time, hips are staying square to the ground. And then doing just some general strengthening. This can just be some heel raises, so going up onto the toes and then back down, making sure you're keeping the weight over the ball of your foot and not letting those ankles roll out to the sides can help strengthen the gastroc. And you can do these in tons of different ways. And there are tons of other exercises that you can do to strengthen the foot and the ankles as well, but that's just a general quick overview.
So moving on to some peroneal tendinopathy. So basically what happens is your peroneal muscles run down that fibula, also called your fibular muscles. And basically what happens is there's increased load in that area. So this can be from a couple different things due to increased running volume. So you're running more miles than you have previously, potentially changed your surface of running. So whether that be you're running hills now, running on grass, running on a track. It could also be a change in shoes. So changing your shoe either style or just having completely overused shoes so your tread pattern is worn down are a couple different ways that can increase load.
Another thing with shoes too, if you have one pair that you're running in all the time and you're not like alternating day to day with another set of shoes, that cushion doesn't have time to kind of fully like expand back to its normal in between wears, so that can potentially be playing well too.
So these can cause peroneals to be overloaded. Another way the peroneals can be overloaded is we are overloading that area due to weakness and compensatory patterns, typically from the hip, but also can be even from like the inside of the leg, causing the outside to overwork because we're trying to balance and correct that movement pattern. So a couple different ways that we can correct this. Typically the most common is going to be eccentric loading of the muscles. So an eccentric muscle contraction is what we typically try to do for our peroneals. And basically how we do that is, so for instance, say it's a calf raise, we would try to raise up and then slowly lower back down. So basically it's a controlled descent or controlled lower back down to be able to overemphasize and stretch that muscle into a controlled pattern. So looking at the cause of the increased load in that area and making adjustments can definitely help to recorrect and retrain your peroneals. That way they have less load on them moving forward. So there's a couple different exercises we like to do. The first being a peroneal eccentric trainer. So with banded eversion, what you're going to be doing is you're going to be pressing that foot out, okay? The biggest thing for this one though is you want to make sure it is coming from the ankle and your ankle is going out rather than having the hip turn and roll out to create that banded going out.
So here, my knee is going out to the side, that's coming from the hip. Usually you're gonna feel it there. Whereas the knee is staying up and then the ankle is going in and out and then that slow return back in.
Another way that you could also do this is going to be either a side lying abduction exercise with the band specifically around the foot, okay? That way you have to hold and control that foot outwards while keeping your hips stable in a controlled pattern, not rocking back. Yep, that way. And last but not least, to continue with the band, you can also do some banded side steps, keeping your feet directly straight, okay? That way it's working eccentrically as well as working on that eversion and having to control the band as you're making that outward step. Furthermore, we also want to work on foot and ankle stability, okay? So this can be done in a couple different ways as well. So as we mentioned with the lateral ankle pain, we can also continue to do some calf raises or soleus raises and focusing more on proper form. So making sure that your ankle is not rolling out to make sure we're controlling on both the outsides and the inside of the leg.
And then you can do a soleus raise sitting down. You can place weight on your knees to make it a little bit
more challenging.
Yeah. And then like we mentioned before, it can also be the lateral hip referring down. So your glute med can refer down all the way down to your calf. So if you are having some calf discomfort down here and it's not really going all the way to the ankle, that can be it. But again, it can also be some other things as well. So if you're thinking it is hip referral, there are a couple different things that you can do. Keep in mind that the hip does impact the foot and ankle. So if that hip is a little bit weak, so like in running, you're doing a lot of single leg stance, right? And so if that hip is weak, then it might pop out to the side, that knee might fall inward. And if we squeeze the hip there, so it's going to be you're externally rotating the hip and then abducting the hip. So by bringing the leg out, by abducting it, you're also bringing the pelvis a little bit more in line. And that's going to control the foot a little bit better and help that alignment. Especially in running and single leg stance, that is very important. So incorporating some side-to-side work into your training can be very beneficial because running is a lot of forward and backward and not as much side-to-side. So incorporating a little bit more into your movement diet might be helpful.
So a couple different exercises if we think it's more of a tightness issue for the lateral hip. A good stretch could be your TFL stretch. So there's a couple different ways you can do this. One being standing. So if your right hip is the one that is tight, it's going to go back behind the leg, okay? And then you're going to lean, keeping your hips square towards the left side, okay? Another way you could do it is also having a strap or a towel, bringing the leg up.
So you're using a strap to come across
and having it drop towards the
other side. So you're holding the leg with the towel or the strap and not actually with your leg.
Yep. If we think it is more of a glute med lateral hip weakness, there's a couple different exercises that we can do as well. One being a straight leg abduction raise. So laying on your side, lifting that leg straight up, keeping it in line with your body and back down, okay? So not having your back rolling onto your back or onto your stomach, just straight up, okay?
And you can also scoot back and go along your wall and then back down. That'll prevent you from rolling back and then also keeping that knee facing forward might be helpful for you.
Yes. Another thing, similar to our eversion steps that we were doing, you can do a side step with the band. This can either go right above the knee or right around the ankles, but making sure you keep your knees and ankles squared straight towards you.
So here it's going to work the hips a little bit more, whereas here you're going to get hips and thighs of the calves as well. So that's the same exercise, but a slight variation of it can bias things a little bit differently depending on what you're trying to do.
And again, we can also work on our single leg balance and RDLs. So that being squared hips, reaching towards and coming back down.
And you can also hold a weight in your hand to make that a little bit harder for you as well.
So like we've said, there's a bunch of different exercises that can target the lateral hip, these just being a couple different ones.
So if you do want to know a little bit more about why the foot and ankle is important and why you should be training it, we're going to go ahead and link a video here for you to watch. And then I do also have a follow-along lower body workout that has a little bit more advanced exercises in it, but focuses on the foot and ankle. So we'll link those two videos here for you to take a look at. And then I do also have a foot and ankle prehab program if you do want some more specific exercises just to target your foot and ankle, whether it's mobility, strengthening, balance, and a little bit of everything there for you. Go ahead and let us know if it is helpful in the comments below.